We are good.
Okay, so I see the YouTube live. I got that message, but they're both okay now?
We're good to
Okay,
go.
perfect. All right, so again, welcome everyone. I know Mark couldn't make it today, Mark Pizzella, and Alice Forrester also sent that they can't make it, but Taylor has offered to take the minutes, so we'll get them to everyone, including you. Later this week, she said she's going to be right on it, so we appreciate that. Um, So once again, we've been appointed to continue our work. Must be that we're doing a great job, right, Christopher?
Yeah, and I do think that they know that we're like not interested in
Right.
continuing, but they codified this, not in the most recent session, but the previous one,
Yeah,
and didn't let anybody know, including the
yeah,
clerk.
yeah,
So we just found out, Christian just emailed us, what, like 3 weeks ago? Like the
yes,
day before we emailed you guys
right,
to say, oh, we have outstanding work. So,
yes. And this is about the time frame we've had. So we're
yeah.
used to running in this quick time frame because they prefer it by the new calendar year. And I really think that the information that they're asking for is important. A lot of great work has been done. So I'm glad that they're interested. We can get them a report back saying, yes, please continue, these following programs. And I thank Taylor also for all the information that she gave to us. So I think everyone knows each other, but no, should we go through just to be sure?
Yeah, do you want to, yeah, if we
Yeah,
could start with you, Alicia, just who you
sure.
are, what to do.
Right. So now I'm retired, Alicia Roy, after 36 years, but I'm still staying involved with things in the community. And I started a 501(c)(3) before I retired. So I'm staying on that board and really trying to help that community continue on. So I'm still happy to be a part of this. Christopher, we already gave away your surprise, so why don't you go next?
Yeah, that's all I got. I'm Christopher Trombley. I'm here at Southern Connecticut State. And I am for this year, the interim dean of the College of Education here at Southern. And
Christina,
now
I
we
have
can
you next to the mic. Go ahead.
say it again.
Are you okay, Christopher? Is that more you want to say?
Nope, that's all
Okay.
I got.
All right. So Christina, I have you next on the screen.
Yep, I'm Christine Velasquez from the Connecticut Department of Public Health, and I'm in the maternal and child health area, and I oversee the school-based health center program.
Excellent. Thank you. Jennifer?
Hi, everyone. My name is Jennifer Jones. I'm an education consultant at the Office of Early Childhood, working in partnership with Commissioner Bai on this task force. Good to see most of you again.
Yes, thank you. Tanya?
Good afternoon, everyone. I'm Tanya Hughes. I'm the Executive Director at the Commission on Human Rights and Opportunities, and I'm happy to continue on this task force.
Thank you so much. Katie?
Hi, I'm Katie Durand. I'm with the Connecticut Department of Housing. I primarily focus on the statewide response to youth and young adult homelessness. We have a fancy new virtual background as well, but for some reason I can only get it to work on Teams.
Well, we'll look forward to next meeting. Maybe by then I'll have it perfected for YouTube.
I've seen DOH's too. I really like it. It's a little just, yeah, everyone got cool ones. I gotta put a letter in.
Oh, but the hands are cute though. They really are.
Yeah, it could use a little bit of more color though. But yeah, just a little, right? But you wore your matching blue shirt, Jennifer, so you're all set. You really were well coordinated.
Accessorizing is everything.
We got it. We have to make most of what we got here at the state.
Tracy?
Hi, everyone. Tracy Duran from the Judicial Branch Court Support Services Division. I oversee the Juvenile Court Clinic. We're responsible for conducting all the forensic mental health evaluations for the Juvenile Delinquency Court. Good to see everyone.
Yes, thank you. Anne Marie?
Hi, everyone. Anne Marie Cullinan, retired educator, administrator, and now doing consulting work in districts as an educator on special projects. And I'm happy to be part of this task force.
Thank you. Thank you, everyone. So I'm going to share the screen. Taylor gave me that permission so that I can try to look at documents with you. See if you can see what. We got the agenda. Can you see the agenda or no? Wait a minute, let me share first. Now you'll be able to. All right, now you can see, great. All right, so not the agenda, but here's the agenda. All right, so we did the introductions. So we know we're going to continue here and we can see our charges in case you can't pull up and make it a little bit bigger if I can here. There we go. And I'm sure you had a chance to look at them. And when Christopher and I read these, it was like, oh my gosh, there could be a lot here. But I'm happy that the state wants to know what they can continue, what we think is valuable, because so many great things were started, I think, unfortunately because of COVID, but really to help us. And we need them because of COVID also. And then the needs assessment is the B part, which seems a little harder, but Christopher already has some great ideas, maybe how to get that going. So I think as far as looking at the first charge, if you look at those spreadsheets, I put them all together in the Google folder, but otherwise you can open up their, either one of them and see the same information. So this one that I'm looking at here is the long one that has lots of, is the right one? No, this one is the one actually that pulls it all together. I thought this one really takes from the other documents and talks about some of that funding that is needed. So you can see DCF is in number 8, also number 10. So 8 is data to help them figure out how they're, looks like helping, helping people and accessing. 10 is to keep that care going or expand it for all this mental health, which also is, let's see, is that the same? That also 32, is that DPH? It could be, right? Because yes, it's families with drugs and helping them to get those, it looks like. Then 40 is peer-to-peer support. So that's under, these are all DCF too, it seems, which is why I'm on the DCF page. Hello. And then there's a few more here. So I'm on my 3rd tab actually. More mental health support, and great columns here that tells you how much has already been implemented, how much it cost. And then if they really thought it was going to be ongoing anyway, maybe the state seems to have done that. And then in-home care. So this sheet I really thought had a lot of information. It's this first tab that is the one that goes through each one, but some of them you can see there's NAs. So it seems that they haven't either started, or there's not really a cost, or there's not a need for us necessarily to look at that, but you might want to look at that and see if anything in there. Christopher, do you have anything in that, this first tab here? I thought that 3rd tab pulls it all together.
I did too. I mean, I feel that the information that we got, isn't super complete, but it's definitely a start.
Yeah.
Actually, before we go further, Linda Dixon joined us.
Oh, good.
So welcome, Linda. You're down at the very bottom of my screen. So good to see you. And do you want to remind us from which agency you are coming?
Hi, everyone. I'm Linda Dixon from DCF.
Yeah, Children and Families.
Okay.
Right, great. So
yeah, so
you've been very busy.
Yeah, super busy.
Yeah.
So I think what when Alicia and I first got contacted by Christian, and after we overcame our initial surprise, I started thinking about the last legislative session, and I remember that the chairs of the Appropriations Committee, Senator Austin and Representative Walker, had been very sort of vehement in finding out from the administration, what money had been, like the federal monies that had come in because of COVID, where had it gone and how much of it had been spent and how much was left. And so we do have a call out to OPM, and they're going to work to get some information together, but they couldn't get it all, as quickly as we needed it, which is okay. But I also think, just reaching out to you all, who are
Right.
at state agencies, if you could work your magic with, the budget and finance people to find out, how much money did each of your agencies get and to which programs was it allocated? That would be really helpful. And we'll have to do
And
the
the-
same thing with the school districts as well and with the Department of Education. But I think ultimately it's potentially exciting that the legislature's, curious to know which programs need to continue with, appropriated monies now that the one-time funding's gone. So back to Alicia's question. I mean, I think, this was really helpful, but I know it's incomplete. And so I think this is the kind of information though that we're looking for. And then we want to determine, and you guys would know better than we, because you're out in the field in those agencies that are providing the services. What information, what data do you have about the effectiveness of the programs that were funded with these one-time federal funds?
Yeah, and even personal stories will help us with this too, because I think there are examples of how well these funds have been used and how great the need is. Not to go off on a tangent too much, but I was shocked at the end of last year. So I'm done with the school year. We're all set. And one of my students, elementary school, so middle school, because we're elementary, we're through grade 8, committed suicide. And there were no signs. There was absolutely nothing. And just talking about it, I'm getting, with the shivers already, thinking, we just need these services so bad because there are so many hurting young people. And then did you hear the Surgeon General also stated just, I think it was this week or maybe the end of last week, that families are in such a high state of anxiety that he is truly worried about the physical state, the welfare of our country with these families. So, wow. I mean, I think that all is supportive too of the great need for these funds to help people. Any comments or?
Yeah, I have a quick question. I might have missed
Yeah.
it because I stepped out a minute, but who did you get
Sure.
this list from, I guess? You might have said.
So Taylor Aiken, who was our legislative aide,
Uh-huh.
put it together. Yes.
Okay.
So this was put together at the beginning, middle-ish part of the session this year by our policy analyst for HDO for the Appropriations Committee, who since went on maternity leave. So we didn't get an updated list throughout session, which is why it's not.
Okay, yeah. I was gonna say one main project I'm working on is not on here and it's $10 million. So
Which one
for
is that?
school-based health centers.
Oh,
Yeah.
yes. Well, on that,
So-
and that's, go ahead.
I guess I'm just trying to think like if we could somehow get an updated list, or we all individual agencies should try to contact our fiscal people and see if we could get a list.
Yeah,
I think-
if we do both,
Mhm.
Yes.
right? I mean, if we all try, and
Yeah.
then, I mean, I've contacted also, I've reached out to the RESCs to see if I can get anything from them about
Yeah.
how they're helping the schools. So, if we all reach out for contacts and get whatever we
I'm
can.
just wondering
and-
if like OPM has a master list of all of these things, but
Yeah, and I think you had stepped out to get your youngster off the bus, but
Yeah.
yeah, I think that's what we're doing.
Okay.
We have reached out to OPM because, and this is what I was saying before, I know Representative Walker and Senator Austin from the Appropriations Committee were very keen in this last legislative session to find out, how the federal funds had been spent.
Mhm.
And how much was left and where it had been spent. So they asked OPM to do that. So I feel like we're not asking OPM to create something that doesn't already exist, because I believe they had to create it
exactly, I
for
believe so too.
Yeah,
Yeah.
so we have a call in for that. They just couldn't get it to us by this meeting.
Yeah.
quickly,
But that's
yeah.
definitely something that we'll get. But even with that, I do think it's a good idea if each of you reaches out to your own agencies,
Yes.
finance people, because that'll probably be finer grained.
Yes.
And then we can put it all together and in a compelling report. Because I think, that's the first part is, how were the monies spent and, were they perceived as effective and, what are the continued needs? And then, Alicia, do you want to talk about the second
Yes.
charge too?
Sure. So let's go back then. Let's just go back to look. Because this one I think will be a little more challenging for us when it talks about the needs assessment that identifies gaps between existing conditions and desired outcomes, the extent to which the gaps are attributable to the pandemic, focusing on children and individuals enrolled in high school from graduating classes 20 to 23. So those students have kind of been dispersed now because we just graduated the 2024 class. So that's where we're going to have to start getting a little creative. Before we continue, Katie, do you want to ask or say something?
Oh, yeah, I just had a question. When we reach out to our fiscal folks, is the template that you put in the Google form what you want us to follow, like funding from fiscal year 23, 24, 25, implementation status, or are there other columns we should add to that?
I think those
Alicia, you're breaking up.
great start, but to write the report, you do this unstable. I'm not in the best place. I'm sorry, trying to do this.
Do you want to turn off your camera and just do verbal?
Okay, maybe that would help. Let's see, I gotta get back here to, give me 1 second. Stop video, okay. All right. Is that a bit better?
A little bit, yeah.
It's a little bit, okay. I can close some of these tabs if we're not going to use them, that might help too. If we can also, because to write the report, adding any other kind of stories or an explanation of some of the numbers would also be helpful. So if you can put that either in another attachment to the spreadsheet or however you want to add that information, I think it makes a great report when you can just share a little bit of what this, what the numbers represent.
Okay.
Christopher, comments?
Yeah, and I was gonna say, I'm not so worried about the format really.
Yeah.
But I think, yeah, if you know the which federal act the money came from and which years you had it and how much money, it can just be a narrative form with bullet points. It doesn't necessarily need to be in a spreadsheet. But I think, as Alicia said, knowing how the money was spent and how it was dispersed would be really helpful. Because I think ultimately that's what the General Assembly needs to know, what good programs
Right.
have been happening because we had this one-time money
Right.
that we're not going to be able to do unless we find an alternative source of the money.
Well said, thank you. So for B then, Christopher, you had some thoughts when you and I were speaking about how to gather some of this information.
Yeah, I mean, I'm a little disappointed with the language of it, honestly. I think you and I were talking about this when we were
Yes.
connecting, just because I feel like, to limit ourselves to collecting data for the kids who graduated in 20 through 23 inclusive is pretty narrow. But those are data that I think we can collect rather. I can reach out to the School Counselor Association, SISCA, because the school counselors tend to use Naviance, and they sort of follow up with kids post high school for a few years. I don't know what the rate of return for kids providing information back to the school is, but I want to make, within the universities, I'm certain I could get information, but I want to make sure that we're not limiting ourselves to collecting information from kids who graduated high school and then went on to, post-secondary education. So I think if we use the school counselors, and the data that they've collected through Naviance, at least as a starting point, we should be able to connect with kids who went on to school or who went on to work or who are doing apprenticeships or who are, just sort of piecing together multiple jobs or whatever. But I think that'll be sort of a good start. And then, I could even do some focus groups if need be. It wasn't last year, the year before, you'll recall, we had a great, we had some really good information from kids, through, CAS, the Connecticut, Administrator Association, Connecticut Association of Schools, because they have a group of teenagers, who were really helpful to us when we were collecting information about school start times. So I anticipate that they'd be able to give us some good information too. And it might, they're still in high school, those kids, but the information that they could provide would be, I think, invaluable. But any other suggestions that folks have, I think would be helpful. We could also reach out to, boys clubs and girls clubs and United Way and Domus and all of the other agencies that sort of work with kids.
Yeah. We got a Domus rep on here too, if able to come, so.
Yeah. Oh, Alicia, I'm sorry, Anne Marie.
I'm thinking, I'm also thinking maybe we can contact the adult ed consultant from the State Department of Ed and see if we can get some data on students who are in that 2020 to 2023 enrollment in high school and then went on to adult ed and got GEDs or high school equivalents, or who, are still not graduates.
That's a really good idea.
Yeah.
And I guess that's what I would just ask each of us to do as we're walking our dogs or taking our kids to the bus or picking them up from the bus or folding laundry or whatever, as you guys think of, this is a way we could get some information about that population that'd be really helpful. And we don't have a lot of time, but I feel like, I think we actually have more time this time than we did the last time. So if we have a plan in the next few weeks for how we're going to collect these data, then we can go about doing it and then putting together, not an exhaustive report, but a compelling one at least.
And I think we should include beyond just those years, because all the work, Jennifer, that you're doing, I think it's just so important. And we've seen students coming into elementary schools who have gaps because of COVID. You can just tell they were not socialized, and all of these things really affect, so much. Housing. Every one of us who is here on this task force can contribute things. I know, because there's so much more, and it's part of the pandemic, and it does affect children. It does affect families. And I think if we don't talk about that younger group, it's going to be a problem. So Jennifer, you have any comments about that? Is she there? You have to step out, she said. No, okay.
Oh, right. Yeah,
anybody else? Yeah, for daughter or kindergartners. Yeah, I think there's just so much we can pull. And we'll give them that focus, but it doesn't say, exclusivity. It has to be, right? So the focus will be on that, but we can add the other groups too, or other things that you bring in, because I think those gaps are still there. And if we don't continue some of that work that we've done with mental health, like we got a new social worker part-time, but we share it with another school because of this money. And it's just been so helpful to have another body in the school to talk with children. All of that is just so important.
Yeah, and I think that's the kind of sort of qualitative piece, Alicia, that we'll want to make sure that we include. Because I think those are the things that sort of stir legislators. Oh, please, Tanya.
We,
Right.
at CHRO,
think
we
so.
have a
Yeah.
Kids Court Academy program where we meet with children from middle school through high school bi-weekly on a virtual basis. And we've been doing this since the beginning of COVID, but we haven't
Mhm.
captured any kind of qualitative data around the types of discussions that we're having. We're having discussions with kids about how they feel about their experiences with COVID and other types of things that affect their lives, that could possibly lead to suicidal ideologies and things of that sort. But we try to just give them a resource to speak their voices, and then it's also a social justice leadership kind of liaison program, an introductory program to the law. But what I will do is take it back and see if there's any kind of data that we can gather from the work that we've been doing as well.
Right, it'd be great
That'd
to
be
know
really
how,
helpful.
yeah, how many students maybe have been served.
Right.
that
Oh, I
kind of thing, yeah.
definitely can provide that.
Good,
We have over 100 students and it's ongoing year round. So I'll provide that information to you.
Yeah, I
Yeah,
think
and
that'd be
if
very
the
helpful.
if your colleagues who sort of facilitate the program can even speak to any trends or patterns that they recognized, you know,
Sure.
because you said it's a program that, is it a program that began prior to COVID?
It did begin prior to COVID, but it segued into an all virtual program
Yeah.
after COVID. And so, yeah, we can speak to that. I'll get some information for you.
Oh, that's
That would be
brilliant. Thank
great.
you.
Yeah. And I bet you we all have stories like that that can go along with some of our data. It'd be
Yeah,
great.
and I mean, I was thinking too, in terms of, you know, reaching out to CISCA, the Connecticut School Counselor Association, I think, you know, we can ask them both for data about those high schoolers, right? The years that they're specifically asking for. But they're also in the trenches too, the school counselors, right? I mean, I used to be one of them. And so, you know, you have a kid who's having behavior changes or a family who's struggling or whatever, you know, I think they could give us some valuable qualitative information about what they've seen over the last however many years. So, and the truth of the matter is, we actually did. I'll go back to the reports that we've written over the last couple of years, because we
Yeah.
certainly addressed how COVID had impacted things.
Right.
You know, when we were addressing the sleep needs and other things. So we can go back to that as well.
And Christine, are you seeing some more family crises since COVID?
Yeah, so
Already?
we've
Yeah.
already distributed a CDC Crisis Cooperative Agreement grant through our school-based health centers, and that was $12 million that has been
Right.
distributed. So we are actually just starting to process that data, and I'm hoping we could have something tangible that we could use for this report. And we just started distributing another $10 million, which is specifically ARPA funding. So that those grants are just their contracts going out to school-based health centers. And at this point, I would only have how many schools we're touching. We don't have any data yet on those, but to show the increase of services being provided is still something worthwhile. So I'm going to work with, I have a data person that does the school-based health center stuff with me. So I'm going to work with her and see what kind of things we might be able to contribute to this. We've definitely get anecdotal information too, which I'm not sure we can really separate between the elementary and the high school. It kind of is a lump, but I feel like a lot of the kids have the similar issues no matter what the age. But I do write a narrative in our maternal and child health block grant, specifically an adolescent section, which I every year have outlined the pandemic and the needs that have been coming up to the forefront through our school-based health centers. So I think some of those narratives I can pass on to you guys also that could be helpful.
Please.
Yeah,
Yeah.
that would be
Yes.
really helpful.
I know we had the school-based health center in the school, and it really helped because people were done. It was summer, but I had this crisis. I had to still deal with it. And
Yeah.
they really came forward to help us. They, you
Uh,
know, it was just wonderful. Really
And
wonderful.
it is, we already have a state line item, $10 million that goes out to over 90 sites, and that's consistent funding. But with these other two pots of money, we've been able to fund over 100 more sites, either new or expansion of sites. And, you know, to see that money go away, the services might not be sustained. So it is kind of worrisome.
When I
Right.
was just sitting here doing mental math,
Mhm.
with a little help from my telephone calculator, you know, that like 10 million sounds like a lot, but if you
Yeah.
look at the 350,000 school-age kids in the state, it's
Yeah.
like $28 a kid.
Right.
So it's really not that very much, but
Yeah, and it's only, they're only touching certain communities and if their community applied for the funding. So, you know, it's worthwhile money, and it's the problems aren't solved just because they had one year of funding, you know.
Right.
Right.
They
For sure.
continue. So
Any other ideas from anyone else or anything to add? What else we can look into, or I'm sure you'll go away and come back with some more information. That's what we really were looking for. I wanted to just set it up for today. We can go back to this. The only other thing on the agenda, then I can have everybody look at each other again here, open the screen up, is the upcoming meeting. So I went by the the Doodle poll that I had sent out and people's responses. So this time frame seemed to be the best. So I went with the first Wednesday of every month. Does that seem to work for people?
sure.
Okay, we'll do it online again. And we will send out the minutes as soon as we get them, which will be later this week, I said. So that'll be helpful too. All right,
no
so we've got
pressure,
some more.
Taylor. We know
No,
you've got
she
other
already
stuff
told us
going
end of the
on.
week. I know. We really appreciate that because people who aren't here, just to remind everyone what we really talked about today too doesn't hurt. People who weren't here and even those who were, just to have a friendly reminder, I think is
Right,
great.
and then even for folks for whom this time doesn't work, some days or even all of them, I think people can still be providing us some information.
Absolutely.
You know, Irene, for example, from CSDE, you know, I'm sure she can get us some really valuable information too, because a lot of money went through CSDE to the school districts. So just to have a comprehensive list from them will be really helpful.
Right.
Sure, we'll
And
all gather things before the next meeting, and should we email those to you, Chris and Alicia?
Yeah, if you
Sure.
email it to both of us, and then we'll work with Taylor to get things posted into, you know, the platform. And I mean, we'll continue using, I think, the Google folder that we've been using internally, but then we'll also, once we're all set, we can make sure we share it with Taylor so she can put it on our, you know, special page on the Children's Committee page.
Right, which is on the agenda. So you have that link there. You can always find data there as well.
I
Great.
just wanted to mention that judicial blocks me from Google Docs, so it's just judicial, but it's
It was
okay.
me too. When I'm home, it's fine. When I'm in the office,
Oh.
I can't access
Yeah, I
either.
can't do it even at home either, so
Oh,
That's why we're doing it both ways for you. I'm either
Yeah.
trying to do a PDF or the Google, and you know, because it's hard for me with the Google, and I'm on my, you know, personal laptop here, but it's
Yeah.
Mac and it doesn't, oh, you know how it is, all these things. So we put it in enough, it's the same information, so don't worry, you'll be able to see it through one of those platforms.
Yep.
We understand that it's hard. So we're not putting just in Google, we're trying to put it also in either, you
Yeah,
know,
and
yeah,
I think what we'll do
or-
too, as we start drafting things or compiling, is making sure that as we have done, we've continued to share them in the various iterations so that folks always know. And I mean, I really think we should be proud of the 3 reports we've cranked out. And I know I had a meeting with a certain chairperson in January, and he was like 248 pages or whatever it was, the most recent report. So
Well, but a lot of it is references and things too. It's not a lot of heavy reading, but it's important
No,
information
no.
so they can refer to use for that and that we're asked to fulfill. So yeah, great.
And when dissertation writing students eventually go to study a piece of legislation, it'll be very helpful to them. So
There you go. And you can help them, Christopher, to get toward that because you have access.
but I think we're in a good place. I think, folks know the kind of information for which we're looking. And as I say, as you're doing chores, or as you're at work, you'll think of something else that will be potentially helpful. So if
Right.
you don't mind sharing all of those things, we'll make sure that everybody has access. And then we'll get going. And in the meantime, Tanya, if you don't mind reaching out to your colleagues about that, that's fantastic.
Absolutely.
And I'll reach out to the School Counselor Association and also to the Association of Schools to see what information they can pull together for us.
And one of
And
us
then-
should reach out to Irene too, just to see. You think, Christopher, I mean,
Yeah, I
we-
think, one or the other of us can do
Yeah.
that for sure.
Linda, how are you managing with all the funds there for DCF?
Yeah, we've got, most of this stuff went out to mental health services,
Okay.
through Frank Gregory's shop and through Carillon. So it hit the ground pretty quickly. And I think we have a lot of this information already organized in spreadsheets.
Excellent. We'd love to have that. And, we were hoping that a lot of this is out there, that we can just compile it and put it together. That would be great. And with anything else from you that says, yeah, especially we need to have this, or, that would be really helpful, or all of it is helpful, whatever your, thoughts are, so we can add that. I think that would be great. Good. Anybody else? Katie, anything that you want to add, Katie?
Nope, I already started compiling stuff to email to you. I'm good.
Awesome.
All
Thank you.
right. Beautiful. I don't know, I could give everybody, I think I already did, maybe not to edit, but I will, in the Google folder, if you have that availability, you can put those documents right in there. If not, you can just email them to us and we'll take care of that too. But the link that I gave you for the Google documents, I'll make sure you can edit it so you can add documents in there too. Again, if you don't know how to do that or don't want to do that, Christopher and I will take them and we'll do that in that piece. Or you can't do it, I understand. So we'll take care of that too. At the state level, you can't always do that, and we understand. Anybody, anything else? And I'll be sure to share if we get anything in between that's very helpful to share it with everyone. Just send out a quick message that here it is, or so you can see it and use it, or not, but just so that we stay fresh, because it's going to go by fast again. This time's going to go by real quickly. It'll be due. But I really feel that people do have a lot of information, Christopher, that they can just share with us, sounds like, which is great. And then the needs there. So you don't want to lose this opportunity to get those needs fulfilled. Keep them
Sure.
going if we can support them, right? Anything else, Taylor, that you want to?
No, just let me know how I can continue to be of support, or if there's any information that I might be able to gather to help the committee. I'm happy to utilize the resources that are available to me. So
Excellent.
So
Excellent.
Alicia, just a question, should I try to contact adult ed services throughout the, in the state
Sure.
and see if I can get those numbers? Okay.
Yeah, that would be great.
Yeah, that'd be huge. Thank you.
It would. Yes. Thanks, Anne Marie. Jennifer, how are you doing? We didn't get a chance to talk to you again because you had to.
I apologize.
Oh, we
The grammar school called me
Okay.
because my son is having a meltdown in the bus line, and the
Oh.
buses are 25 minutes late.
Oh,
Not
no.
because of him, but because they don't have it down. And he's
Right.
4 and 10 months, and he's been waiting in line for 20 minutes to get on and he just.
Oh,
So she just wanted to let me know, but I haven't had them call
Sure.
me yet. So I was like, oh my God. So I
I know.
apologize.
no. No,
I
please.
did look at the spreadsheet. OEC is not on there at all. So we have lots of ARPA projects.
I know, and I'd love to have some of that
Yeah,
information.
I can definitely
Yeah.
work with folks and
Right.
get that data for sure.
Did you have a good summer? Continuing
did.
on with all that work? Yeah.
it's still continuing now. We're building a
Yeah.
branch state-funded system while we manage a current state-funded system for
Yeah.
childcare providers. So, but it's all good
But you
stuff.
have a cool new logo, so there is that.
I do like the hands. We got to vote as a staff on the hands because like that
Yeah.
was kind of like our thing, right?
Yeah.
Good.
But yeah, no, I
No,
can
you do have a
definitely,
lot.
I apologize if I missed that, like a timeline that we want to get data for at least the first, bullet there.
Well, whatever you have, you can put it in that Google folder or share it with Christopher and me, and we will put it in there and make sure everybody has access to it. Taylor can put it online too on the state legislative website page that we have. So whatever you have, whenever you have it, because I know you have a lot, and I was saying, but you were not able to be here, that we want to include that. We spent so much time, and we've seen the younger students also affected because of COVID. So we don't want to leave
Oh,
them
yeah.
out. And we can stress that in the report, why we're including that information too, because we've just seen so many different social skills or lack thereof, or differences because of COVID and how people were not socializing and how that affected the children. So, it's all very important. So we definitely want to include that in there. Yeah. So
Yeah,
thanks for
absolutely.
coming in.
Yeah,
Staying
and I
apart.
think as we have each time we've met, I don't think we're asking anybody to, create a report that doesn't already exist. I think most of this information exists in some form in your agencies, and just having access to it will be really helpful so that
Yeah.
we can, put it all together.
Right. We want to make sure the legislators have it too, that
Yeah.
they know. So, right. They'll get that funding for us to continue, we hope. All right, then if nothing else, Christopher, anything else?
No,
Alicia,
Please.
Alicia and Christopher, could you stay on for a minute? I have a question on
oh, sure.
something else.
Yep.
Thank you.
Yeah, no, for sure. Yeah, so we can say thanks, everybody, so much. We'll see you
Yes.
all on October the 2nd.
Yes.
Same bat time, same bat channel, and we will, and then we'll just end the meeting or no, not